We've got Nikhil here on our podcast. The podcast is called Cypher 2024, All You Need to Know by 1 in the Afternoon. That's the full title. It's a working title. I'm trying to come up with something better. So if you'd like to sponsor it, we'll call it Nikhil.
Absolutely.
Done?
We look forward to that.
Nikhil, be careful. There's a spaceman behind you. I don't want to get thrown. All things happening here at the conclave as we speak. But Nikhil is representing... I know. Sometimes you wonder what you've been eating. Yeah, but Nikhil is from Tata 1mg,
1mg,
which is basically like a health platform. And so he's going to take us through it very quickly, what they do and how he's going to make the world a healthier place.
Yeah, so Tata 1mg, for those who don't know, is India's largest integrated healthcare platform. Largest in India. We are the first in the digital space, supplying medicines and doing diagnostic tests. But today it's much bigger. It's part of the Tata Group. And basically providing medicine delivery, providing diagnostic tests, not just online, but also now through omni-channel, through offline retail, as well as powering supply chains for some of the biggest hospitals in India. You must have seen TMH in Mumbai.
Yeah.
Then Tata Memorial in Kolkata.
Yeah.
So we're powering the supply chain for some of the largest cancer hospitals in India and providing healthcare basically.
Actually, on this subject that you brought up about being a Tata company, I have a Vistara flight at 6:35, which is trying to move to 9:35. Could you make a call?
What, do you want to switch to Air India?
No, I want to stay on Vistara only.
Okay.
I do like Air India, but I'll just stick with Vistara. But I want to be on the 9:35. Can you just, if it's possible?
Let's take it outside.
That means no. That's Nikhil.
Unfortunately, my reach into healthcare is good.
Yeah.
But into airlines,
Not bad.
call me any day for a help.
Yeah. All right. Getting back to your space, what are you going to be presenting here today?
So I just did a talk.
You just did.
We're talking about how we are using data and AI in the healthcare space, not just to make Tata 1mg better, but to make the larger healthcare space better in terms of driving outcomes for patient healthcare through data and innovation. So we get almost 200 million users on our platform every year.
But without asking an aggressive question, but isn't that what all the platforms are doing in terms of the healthcare platforms that are out there?
Yeah. What helps us that we are the biggest one. So
You're the leader in the space.
we are the leader in this space. We have a lot of data. So like I was saying, we get almost 35 million users a month, 200 million users a year.
Wow.
And a lot of them are transacting on the platform, and we get to understand who those users are and what their healthcare requirements are. So just by virtue of that, our ability to actually innovate and solve on their behalf becomes a lot better. So that's what we are counting on.
So in the long run, is it a cheaper option?
To do what?
If I'm monitoring my health through the health platforms like Tata 1mg, is it a cheaper option than the old-fashioned
Cheaper is there.
pharmaceutical, I think?
Yeah. So cheaper is one part of it. I think the last part, very important. But when we started off and even today, our vision is to make healthcare accessible, understandable, and affordable. So affordability is one part of it, but accessibility and understandability is also equally critical. So when you take a medicine, we should know why you are taking that medicine, and
Well, I normally take it because my wife's talking too much, but
that's only headache which you have.
yeah.
The other conditions.
Starts from here and goes all the way down slowly. Yeah. Degenerative sort of disease.
Yeah.
The last thing I'll ask you is, the issue with the hospital beds that we had in the pandemic. So, and also I've had a couple of personal stories which are not very nice, so I won't get into it. But this demand supply thing that seems to happen, why is it that we sometimes have this feeling that there's just not enough hospital access, as you say, for the common man, and sometimes even for people who are well healed?
Yeah, I think it's a traditional problem, and just the scale of infrastructure has not met with the increase in population and the demand which is out there. But I think the government spending is increasing, the infra is getting better as more and more private companies are getting in. There's more access to premium healthcare also. So I think it's getting better, but again, the disparity is so high that just getting it, and that's where data and AI can help a lot. For example, for vaccinations, just making sure that the right vaccine is available in the right location, in the right quantity. It's a data problem. If you can predict the demand and if you know the demand across the country, then figure out the supply chains accordingly.
Correct.
Traditionally, our demand was never captured digitally, so we didn't know all of that. So I think that's where all of this is going to help.
Fair enough. Thank you so much for being here.
Thank you so
I know you're very hungry and you've got to keep your health up. Blood sugar level should not drop. So, Nikhil, Tata 1mg, thank you so much.